Nicole Nash Pena, and I will be presenting on the critical role on race and ethnicity in reporting. So, a quick introduction of myself. My name is Nicole Nash Pena. I am a health science major, chemistry and biology minor from Howard University, and I am interning at Dr. Strekalova's lab at the University of Florida. So, a bit of background. As we all know, the goal of HuBMAP is to map the human body at single cell resolution. The program brings together researchers from diverse fields to generate and integrate large scale data, as well as utilizing advanced technologies and computational tools. A critical aspect of the HuBMAP's mission is the ethical and responsibility of handling data, including the collection and reporting of demographic information such as race and ethnicity. So HuBMAP adheres to these policies to ensure that race and ethnicity are collected with the utmost respect for participants and their privacy and are used to promote health equity. This data is crucial for understanding how biological differences across diverse populations can influence health outcomes and ensuring the benefits of biomedical research are inclusive. So the aim of my research was to gather input from subject matter experts, SME, on the reporting of race and ethnicity for cellular level research, specifically pertaining to HuBMAP tissue and organ donors. So, to go a bit about my methods on my project, we carried out a literature search for articles regarding policies relating to the reporting of race and ethnicity data. And some of those articles were the guidance published by the Journal of the American Medical Association, also known as JAMA, and conducted a literature review based on these articles. We also analyzed policy briefs written by undergraduate students who had previously participated in a HuBMAP internship and on their significance of HuBMAP and their interpretation of these policies. Using this information from these articles and policy briefs, we were able to formulate interview questions and conduct interviews with different researchers within the HuBMAP consortium who were either directly involved with the process with tissue and organ donors or had a big part in collecting the metadata for the tissue and organ donors. And this information helped develop a better understanding of the data that should be collected for tissue and organ donors. So these are a couple articles that I used in order to gain a better understanding and background. There are, of course, a lot more, but these are the ones that I decided to highlight. So in the first one, that is the one that I previously mentioned, the JAMA article, which provided a comprehensive guideline to improve the reporting of race and ethnicity in scientific research. And the main goal of this article was to promote fairness, equity, consistency, and clarity in the use of race and ethnic terms in medical and scientific journals. The second article listed here is talking about updates that are aiming to improve the accuracy and utility of these types of data and ensuring that it reflects the demographics and identities of the United States. And then the last article I decided to highlight was an article from the NIH on PubMed, and it provides an in-depth analysis of disease progression and risk factors in patients hospitalized with COVID-19. So it talks more about the risk factors that could be involved and what is used to identify and characterize these different phenotypes of diseases. So in turn, these all highlight the importance to use specifics when talking about racial and ethnic groups, and inclusivity and accurate language can help reduce the mistrust in the medical community. And medical and scientific communities should be vigilant about the language that is used and to strive for an editorial process that respects and accurately represents all racial and ethnic groups in the US population. So while the results are still in progress and analysis of these interviews that I've conducted are still in progress, I some common themes that I were able to conduct from the interviews were that privacy pertaining to the patient is very important. You must follow HIPAA rules and not, of course, release data of the donor that is very specific to the patient. And you must also have specific data regarding what tissue and or organ that is being donated. So it differs what the tissue or organ you are talking about. So there are different criteria regarding if you're talking about the heart or the pancreas or um, any other part of the body. There's different criteria that must be included. And then, as I mentioned, including information directly related to the area of interest. So there's obviously different studies that are being conducted. So you may be talking about what impact the heart does for this different thing, or um, if the area of interest is pertaining to a smoker lung or how healthy the lung is. There's different data that shall be conducted. And then how demographic data is broad. So the regarding demographic data, it is very broad at the moment because it's really talking about whether or not it's black or white or Asian. Is not really specific to whether you are mixed or have an abundance of races um, pertaining to the tissue donor or organ donor. So that also was very common between the interviews, that the demographic data was very broad. And the use of UNOS, which is a transplant and donation website that specifies race, ethnicity, age, sex, all these different criteria that is being collected during the process. And interviewees believe that as much information should be collected as metadata, but of course you must follow the privacy and you can't release too much data pertaining to the patient because that is again, there are again policies that must be followed and continue to be followed. So in a perfect world, there should be as much data as possible, but there are HIPAA guidelines that should be followed. And interviews also mentioned that socioeconomic status can be a correlation with zip code and can be used even though it's not being currently recorded, but it should be. But it also helps when talking about race and ethnicity and how socioeconomic status can impact a patient in regards to tissue and organ donors and how um, it can be a disadvantage or advantage where the patient may be living. So that is also a factor. So in conclusion, the results of this project will help guide the future policies on reporting race and ethnicity, and the interviews conducted have revealed a deeper understanding for the need of comprehensive reporting of demographic information regarding donors and patients within HuBMAP. And by accurately capturing this information, HuBMAP aims to uncover how genetic, environmental, and social factors associated with different racial and ethnic groups impact cellular and molecular processes. This data is essential for identifying and addressing disparities in health outcomes and tailoring medical interventions to diverse populations. And the long-term impact of this study, it seeks to create a detailed, high-resolution atlas that will revolutionize our understanding of the human health and diseases. And by doing so, HuBMAP aspires to pave the way for more precise diagnostics, targeted therapies, and preventative measures that account for individual and population level differences. So, some key takeaways during this experience. Don't be afraid to ask for help. Of course, I've asked my team for countless amount of times for help, but you must not be afraid to ask for help because you are also learning as well. So it's important to make sure you're getting the guidance that you need. And also, I also was able to conduct professional interviews and ask insightful questions, as well as contribute to the interviews that I were conducting, and be able to follow up with the responses and make sure that I'm asking what I need to be asked, as well as what I'm interested in. Collaboration, you must be prepared to collaborate with different people, different bring to the table what you're able to bring. And we must know that all research is important, as this research may not be seen as the traditional research that people see in an internship is still an important research to conduct and be a part of and gain results, because as again, this is important for the population and to better represent we as individuals. I would like to thank my team, Dr. Strekalova, Michelle Khan, and Rachel Lugavin, and the University of Florida for helping me along with this internship and providing me with the resources and guidance. And I would like to also thank the NIH and HuBMAP um, for allowing me to be a part of this internship and learn being able to learn what I was able to learn. Thank you. And are there any questions?